Dr. Allaqaband sir, very good morning to you. Assalamu alaikum. It is a joy.
Assalamu alaikum wa rahmatullahi wa barakatuh to you and to those who are watching this.
Thank you so much, sir. It's a joy, privilege, and an honor for Kashmir Care Foundation to have you for the spotlight session where we talk to people, personalities who have accomplished a whole lot so that they can tell their stories back home to Kashmiris and Kashmiris around the world. You have accomplished so much in your life and you're still contributing. So, welcome to you again on behalf of Kashmir Care Foundation.
Thank you very much. Privilege is mine.
Thank you, sir. डॉक्टर साहब, 3-4 सवाल आपकी एजुकेशन पे, फिर आपके करियर पे. If I can start with your early studies. Kaite Kashmir man Srinagar mas Kaitipur Elementary School, and then how did you end up in University of Madras for your MBBS?
Short and long of all this is Fazl Allah. Allah Ta'ala sun karam. Nothing else, not mine. It's all His doing. Problem is, I was born as a posthumous child. I was born in a very poor family and I'm proud of it. But the family was religious. And after my father's death, I was born 2 months later. And I went to the care of my grandfather, who died 3 months later. And then I was brought up my granduncles, my uncles of my father, and my own uncle was in mid school at that time. After he passed matric, he became my guardian. And I was born in a place in Srinagar, Kalalduri. Tasmana Kalalduri, you was Naid Kadlas to Buri Kadlas Darmian. And nothing much to say about it. And I was put in a school. Those days was called Hamdania Middle School in Khankai Molla in the compound of Shah Hamdan Shrine. I don't know why they did that, because there was a better school in Baghe Dilawar Khan. There was a better school, Islamic school. And this was not that good school as Islamic High School or Baghe Dilawar Khan Government School. Anyway, I passed my middle there, and then we were shifted to a high school of the same name, which was in Nawakadal. So I had to go to school on foot from Kalalduri to Nawakadal. And in the last lap of my school year in ninth class, it was changed to government school. And as a result, there was not much change in it, and there was no arrangement for either science or physiology teaching. But I took physiology and science in spite of opposition from my uncle, who said this is very difficult. I said, no, I want to do it. Not that I wanted to become a doctor, I just wanted to. And there was no arrangement in the school for teaching this. So we went on a strike, possibly the first student strike in Kashmir. It was in 48, 49. And then we were told, all right, we'll take you to government high school, Baghi Dilawar Khan, for science practicals. And they did that for few. It didn't help. And I was a good student till my middle school. So good that there was a teacher, God bless his soul, he used to tell me, when I ask a question, don't raise your hand. Dopun ush lagi. Kala azna tulan sa thod ki so is hab karit bihar. And I was so good. Then in matric, I failed science. and I got a third division. It was a shock for the family. Well, they said now, no question. Some said you better do government service now. My uncle, who had by that time passed matriculation, was in government service, told me, no, you better go to college. Now the question was selecting the subjects. They said you have failed science, you cannot take science, you go for arts. We had a neighbor who was an overseer, sub-divisional overseer, who had done IT training somewhere in engineering, and it was a hello that he's an overseer, and I wanted to become an overseer. And I said I will take mathematics. They said no, it is difficult. You can't take science and mathematics. You do arts. This went on for a few days discussion. I had a grand uncle, illiterate, uneducated. He said, let us leave it to Professor Vantsa. Professor Vantsa was a professor of English in the university. And university had not started then. He was in the college, but he was associated with national conference, and there used to be Halka presidents, and he was one of the Halka presidents in Navhata. So that's why how my grand uncle knew him. So we went to Matsap. He said, you write an essay in English. Why you want to leave arts and why you want to take science? Now, professor of English asked me to write in English. It was an Herculean task. I wrote few pages. I swear I don't remember what I wrote. And I went and took that 1 week later. He was sitting on a window having a hookah. I gave him the essay. He just tore it and threw it from the window, not reading it at all. He said, I was in Amerson College where they teach mathematics and science. Now I have been transferred to SB College. There is no arrangement for teaching mathematics there. So you better take medical so that I can keep an eye on you. That is how I went for a medical line. And fortunately, I did well. And it was a Jammu and Kashmir University in 1953. And in whole Jammu and Kashmir, there is only one first divisioner. And he was my classmate who became later on head of Department of Cardiology at Postgraduate Institute of Medical Sciences in Chandigarh. And we were six second divisioners. I was one of them. And we were all selected for medicine, and people used to apply at that time. And there was a tremendous amount of push from the government to send people for trainings. And I also applied. I applied for medicine. I applied for agriculture. I applied for engineering, but didn't apply for veterinary. I was selected and told to go to Madras. Now they used to give a loan, and they said, we can't give you a loan. You have to go on your own. I said, I have nothing. You give me a loan, I will go ahead. Then after 2 or 3 days, I went, saw the chief secretary. He said, we'll give you half loan. I said, you give me full loan, I go. You don't give me full loan, I cannot go. It's not possible. So finally, I got the loan. I went to Madras. When I reached Madras, in an unreserved third class railway, by the time I reached, I looked like a coolie there. And stayed one night in an hostel, veterinary college hostel, because there were two other Kashmiris who were deputed for veterinary. We stayed there for overnight. Next day, I went to medical college. And 10 o'clock, they told me, you wait for 1 o'clock, your principal will come. He's on rounds. So he came 1 o'clock. He said, silly fellow, we wrote to your government. The government is incompetent. We wrote to them 15 days back that you cannot be admitted because you are underage by 1 month and 22 days. So we can't admit you. So that was a shock. So I wanted to come back. Now I didn't know what to do. I was told there is emporium in Madras. So I looked for where the emporium is, went there, and they told them, they said, you wait. I said, nothing, this will not happen. I want to go to Kashmir, see, try if I can get in some other medical college. So short and off, it is like I went this time in a reserved compartment, and there was another God-fearing doctor, Ghulam Nabi Kosgar, who was an ophthalmologist who was doing some course in ophthalmology in Madras, and he was going to travel to Kashmir back. So we went together, and under his patronage, I was in the railway. Terror was such that criminal rights of 47 were so vivid that time. We sat in the compartment, and there was a very noble Sardar with us in that reserved compartment. And he used to make nice sandwiches, egg sandwiches, give it to us also. Ghulam Nabi said, we are gone. I said, why? He said, he's going to kill us. He is feeding us. Now he is going to kill us. Till we reached Delhi. And Delhi, we stayed with his brother-in-law, God bless his soul, also Professor Hasnan, who was doing a course in archaeology in Delhi. And next day he said, you have to get a permit to enter Kashmir. And this was a time when we all, those who would enter Kashmir, would need a permit. And this was issued by the Home Ministry of Government of India. So fortunately, the Deputy Secretary there was a Kashmiri there, Mabul Saab. So we went, got the permit. He said, now you have got the permit, I will take you to Connaught Place. We both said, what is Connaught Place? Dupan Connaught Place is Shitki's Jai, Pastor of Rabio Kamshuna Butika. So we went there. Next day I went to Emporium in Delhi, went to Jammu, saw Emporium in Jammu. I came back home, and there was celebration in my home.
So you came back to Kashmir and there was a relief and a celebration. Yahan aa wapas.
Very pressure that he came one piece back.
Yes.
And when he said what all happened, what happened in Madras, then there was an aunt of mine who said this. Dopun yahas Emporium गचा असल बड़ा अमीर इंसान यमिस मद्रास ती दुकान छु दिल की दुकान छु गम की दुकान छु तमिस गरा यु छु Emporium. Anyway, this was it. What goes by, I saw a prime minister and I told him this is what has happened. So when Supreme Court next select, Mr. He was select, you were the chairman. The one Basan to show Sihat Chiki and show Badatanu, Hagarbo Pok Lagaway, Deriava Porgasa. Various PR number Chijan, Naivaria sir. Such a Tiyu, I got to even Wadakar Naivaria to Bug PR. And God bless his soul. He told me, "Dupon Gubra, ach Musalman hai kya, ach very broad wada karit." It was 14th of July 1953, and 9th of August 53, he was no more Prime Minister. And I waited for 1 year. Next year, I was again selected for Madras. I was begging them, please send me to Amritsar, which is nearer. Nobody would hear it, and it was a luck. It was a ordained Allah's destined my future. I went to Madras, which was a good college, and there were facilities for uh, extra teaching there in United States Information Library, British Council Library. I used to regularly go there, read magazines, read extra books, and it helped me a lot. And did very well in medical college. So much so, in 1 or 2 classes, the teacher in the clinical said that I am going where you conduct the class. And finally, While going to United States Information Library, I read that there's some exam called uh, USMG, the exam, United States Foreign Medical Graduates Examination. I applied for it.
So let's take a pause here. I wanted to
Uh,
share with the audience that will be watching this video soon, inshallah. Ki you had a difficult childhood. Your father passed away, uncles took you, they passed away. But उन्होंने आपके लिए कुछ छोड़ा था because you kept on pushing the boundaries. You kept on studying hard. Zutre page Angriz per Lakhon at that time must have taken a lot of courage, and many versions of that 2 or 3 page you wrote. And fail gasit kamyab gatsun. That tells what Dr. Allaqaband Saab is and what he was at that time. Um, and Dr. Saab, now we'll come to the US part of your career. You were one of the first to do residency and fellowship. You spent a lot of time in Baltimore, right? Tell your audience the journey from Madras to United States.
When I was in Madras, I told you I applied for this examination and I passed. When I appeared for the examination, total attendance, there was 300 students from 4 southern states, Karnataka, Andhra Pradesh, Kerala and Madras. 300. And there was none from my class. Nobody knew in my class about this. And they told us this is a question paper, multiple choice questions. First time in my life I had seen multiple choice questions. And they said you have to use this pencil, the special pencil, because your papers will be checked by a machine. I thought they are stupid people. They think that we are fools and they are doing that. And we did that. I passed and I applied for job. I got number of offers in United States, but I was a lone scholar. I went back to Kashmir, joined for a few months. I told them that I want to go. They wouldn't leave me. They wouldn't leave me. They said nothing doing. Before me, there were Dr. Zuhur and Dr. Mahmuda Khan. They had come to United States before me. Dr. Girja and Dr. Naqshbandi had gone to United Kingdom before me. So I said, if they would leave them, why not me? But they won't. This went on, and finally my family told me it is not possible for you to go. You better get married. So I got married in May, and I was still really keen to go. And in May, June, my father-in-law, God bless his soul, who was at that time inspector of schools and then principal in the SP college, he tried to wield his influence, took me to number of people, and one of them was Sagami Saab, who was a minister. And he said, don't worry, we'll get your resignation accepted. My resignation was accepted, and with the supplementary agreement that I'll come back and serve the government after that. So I left. This happened in late August, and I had to be here on 1st of July. July had gone, August had gone, and now I was about to go. I had no money for the ticket. I had no money for the ticket. And begging friends, relations, nobody, nothing. And finally, my family said, we have a shop in Zanakadal, which is on rent, we'll sell that. So it was decided to sell that shop to buy me a ticket. I thought about it whole night and I said, this shop has been in the family for 100 years or so. For me, I said nothing doing. Then couple of Days later, I got a telegram from the hospital that you are late by 2 months. It is possible that you may not have a ticket. We will send you the ticket. You come and pay us back. So that is how I was in the United States. They purchased the ticket for me, and I was all destined and came here. Situation was such that I had booked for New York when I reached after staying in Beirut for a night, in London for one night, coming here and staying in New York. And next day I wanted to go. They said, "Stupid, you have got a New York ticket, which is not New York." I said, "Where is that?" He said, "You have got to take a taxi." So all I had $50 with me. So I went for a taxi from New York to Newark and took a flight there. That's how I was here, spent 2 years United States. Those days were doing the residency, people at Hopkins were selected as fellows also. It was a bright future for me, but my wife didn't come. They said no. My father-in-law said no, it is not. If you come to England, she will come. So I had to leave halfway here, go to England. She joined me there, got a good job there, passed my MRCP London and MRCP Edinburgh first chance. And simultaneously, you are asking the question, why two? One wasn't sure that one would get membership. So I wanted to be safer on this side. Maybe I don't get a London, I will get an Edinburgh. And London was very difficult. So much so, where I was doing a job in the hospital, there was a consultant of mine. He said, "Look, it is very difficult. People don't pass first time, and you may get a from Viva or not, but by clinical, everybody is down." So when I passed my Edinburgh first, I came and told them I have passed Edinburgh. They said, "Congratulations, is good." But the consultant said, "London is a different cup of tea. It is not." I said, "All right." So I got up after my clinical Viva. I came and I told him I got Viva. He said, "Yes." I said, "Yes." And then I appeared for the Viva. There used to be a final Viva. Final Viva, very about 5-10% used to get. So when I told him I got a final Viva, he said, "It is very difficult, you know." And when I went for my final Viva, I passed my, and they send me the envelope outside that you pay 25 guineas, you have passed. So I went, I told the hospital they were having a lunch. I said, "Fellows, I passed the London also." Everybody was surprised and they left the lunch. They stood up and hugged me. It was good. And then I got a job in a very good hospital, Brompton Hospital Institute of Heart and Lung Disease in London as a registrar. But then my father-in-law was ill. He came for his treatment along with my mother-in-law, and we had a baby by then. And they said, "You come back." It was an emotional blackmail. And so I decided to go back. Not only that, I was appointed as assistant professor in absentia for Government Medical College Srinagar, which was a big thing. And so I came back September 64 and got stuck in medical college till I retired in 94.
डॉक्टर साहब, एवरीवन इन कश्मीर नोज कि आपका नाम और अली जान साहब का नाम साथ साथ चलता है because you had magic in what you did, your art, your science, your patience for patience. That's how you are uh, always talked about in Kashmir. मगर मुझे ये लगता है कि डॉक्टर अलाकबंद में एक बुलंदगी पहले से थी। वो बुलंदगी इट्स हार्ड फॉर मी टू इमेजिन वो कहाँ से आई। घर उसने फादर थे, Mana hai muel parno liakno.
Multi asabli Majos kumun biat pat. She was 15 years when I was born.
तो उसमें मुझे ये लगता है तो वो ना बड़े अल्लाह ताला जो अल्थमुत बैठे.
Bilkul, it was all providential help, nothing else.
And you must have inspired hundreds and thousands of men and women in Kashmir and outside Kashmir, and they will love when we air this conversation. That's so फिर आप you went back to Kashmir as a result of blackmail, as you said, but there was love involved in
No,
that blackmail.
not only that, assistant professor, plus my commitment to my family that they did so much for me and I have to be back and be there. And I must say, unfortunately, my uncle was a very strong uh, person. He didn't accept anything for me. And I was not able to do anything for that family which brought me up. I was not able to do anything the way I should have done because he was but a khaddar insan, so manan ki he to the punasa wanchu chu Soporotma nebra kaneti na to do wasina yechun so on gar tatlaya ki you have a rented accommodation, government accommodation and live separately. This also
That was also him thinking about your growth, your prominence, uh, and जो लोग ये कन्वर्सेशन सुनेंगे, अलाकबंद साहब की मेरे साथ रिलेशनशिप भी है.
I know.
So we heard about you through that angle as well. You should Dr. Allaqaband. You should
Right. God bless your father's soul. He was once my patient.
MashaAllah. Na, we would not-
He was in he was in accountant general's office. Is that right?
Correct.
Yes, he was. You were living in Navhata, and he was once my patient.
Now we used to talk about you.
Yeah, and your sister was a colleague. She was in pathology department when I was in medical college.
Yes. Dastav, let's come to that phase of your career where you start building the new talent, the new human capital, physicians, scientists. And your 3 years, you were the principal from 91 to 94. So responsibility to keep building Huperch or skims the Banan Suitse. Um, talk to the audience about what it took to be the principal of a government medical college.
It was a very unfortunate period for me. It was a period when there was turmoil in Kashmir. I was an administrator of associated hospitals earlier, where I think I did some good work. We started bone and joint hospital. We started separate pediatric hospital. We started what was called a JB Pant hospital, which is now was a pediatric and now it's supposed to be a chest disease. We, as an administrator, I wanted to build a good psychiatric hospital, acquired land there, and wanted to have a 700 bedded hospital there, 300 beds general hospital, 200 bedded psychiatric hospital, 200 bedded chest disease hospital, so that these three hospitals would have a common laboratory facilities, they would have a common laundry, they would have a common kitchen and all. But land was acquired, it was fenced, but government changed, it became a governor's role and it was given to fire sufferers. That's unfortunate part. Then when I became principal, I couldn't do much because it was a turmoil, very difficult period. It was a Herculean task to keep college open. So much so that at one time they wanted an examination to be postponed. And I was reluctant to do it. Very difficult period, very difficult period. I couldn't do much. It was a just Herculean task just to keep the college open and keep the facilities in the hospital running. And hospital people did a wonderful job those days to manage them in Bone and Joint Hospital, manage them in SMHS Hospital, and then Laldet Hospital. It was a difficult period. And what I should have done, I was not able to do it.
Dr. Saab, it takes a wise man to operate under difficult circumstances. It takes a bold person to operate under difficult circumstances. I would say you were the ideal person to be the principal during difficult times. Many would have folded and left. You stood your ground. Ite munasib o subkor hota hai. To see two bullets in an envelope must have shaken you up, must have shaken your family, but you still stood your ground.
After that, government offered me to become a vice chancellor of Kashmir University. I refused. I didn't want any administrative. They wanted me a public service commission. I refused. I said nothing doing because I just wanted to get out and feel. And as I went out, December 94, I went to Delhi because my daughter was married in the United States, had come for a, where I didn't want her to come to Kashmir. So I uh, got a flat in Delhi on hire and we spent a month in Delhi. And so that we were all relaxed. 26th of January, Government of Jammu and Kashmir announced that an award for me for my outstanding work. And I got a shock. I issued a statement under these circumstances. It is not advisable for me, it is not right for me to accept the award. So this was the situation. And I went, I stayed in England. And from there, I came here with my son, stayed here for some time. And 1996, went back. And I had a friend of mine who was a minister in government of Jammu and Kashmir, Devidas Thakur, who was in Delhi at that time, told me, Dr. Saab, you start practice in Delhi. I said, no, I want to go back to Kashmir. And I went back and started and stayed there. This is a very traumatic period.
It is, and I think all of us would agree that peace anywhere is peace everywhere. Kashmir has gone through very difficult times,
And it's going.
continues to go through difficult times, but it's voices like yours that bring that component of why we should have peace. The dividends of peace are so many, priceless at the end of the day. You went through so much for that. I know Government of Jammu and Kashmir gave you an award which you could not go in time. I think you deserve a peaceful.
Only they gave me award twice again. I accepted it. I must say. Then
I would say, Dr. Saab, that you deserve a People's Award. And if Kashmir Care Foundation has a People's Award, you are the first recipient of People's Award. कैसी आपकी लाइफ स्टोरी कहाँ से कितकन पिकव कितकन खोव कितकन रूजव कत रूजव your story ki what was Chennai, Madras, you look like a coolie. Those are remarkable observations आपने की. डॉक्टर साहब मैं आपको अब लेना चाहता हूँ बोसुस परवेज कॉलसित कात करन रहत या ज़रात ब्रोड. आपकी बात चली. तो पन अलाकबाद सब जो विंत पारा म्यान को ज़्यादा. You to analyze the kara म्यान को ज़्यादा. Then he writes also, and that's what you keep on continuously reading and sharing your thought processes. Most of it is on Facebook, I see. What drives Dr. Allaqaband to be an active researcher still, or an active clinician still?
to be honest, to keep my upper story intact. And I love my people. I miss them more than they miss me. People's Award, you are saying, I have already got it. The love and affection of my people, which they bestowed on me, both patients and in civil society. I am so grateful. I am so thankful to Allah. I couldn't have asked for better. I am dying to go back, but my personal compulsions are such that I cannot. And the day I am able to do it, I will rush back there and I want to die there. I want to get buried there.
Dr. Saab, you have a long life to live to serve, continuously serve your community. डॉक्टर अलाकबंद का सा नाम जो है ना, इतना प्रोमिनेंट नाम है। मेचुवाना कहते लोग कि आपको देखते ही मरीज ठीक होना शुरू हो जाते हैं।
Well, this is so kind of them, so kind of them. But there are lots of people whom you have not seen who must have a different opinion about me, with whom I have not behaved properly. Some those students whom I have failed, some of those whom I have been harsh to, some of the patients who were not satisfied with me. There are those people also, and possibly they haven't spoken out of their love and respect that it might hurt me. But I am aware of it that the other side also is there. But I am grateful to all of them.
Dr. Saab, let me ask you the last question now. You still have in Kashmir and outside Kashmir a following. कुछ ऐसे भी हैं जो आज की तारीख में मेडिसिन में जा रहे हैं या प्रिपेयर से कर रहे हैं या बने mature doctor and they're in the practice whether in service or in private space. If you are having these students in an auditorium and you are asked to address them, fail to chikarin, pass to chikarin, fail to asa karun ka agar ne pormuchun, so much pass karun. That's also disservice. So talk to these thousands of students virtually sitting in an auditorium, and I'll introduce you the legendary Dr. Allaqaband is going to give you 2 minutes, 3 minutes, 5 minutes of lecture on how to become Allaqaband.
I would say, first of all, you have to be truthful. You have to be truthful to yourself, to your community, to your patients, and to your parents. Never lie, never lie. And then work hard, be sincere, and leave rest to Allah. Question is, those people who out of hello around the medicine go for medicine should not fall prey to it. Those who are committed to go to medicine, work hard, get it by their merit, they are the ones who have brilliant doctors, brilliant young physicians, doctors in Kashmir. All I would like to expose them to something better. It is a tunnel vision. They are schooling in Kashmir. They are getting medical education in Kashmir, post graduation in Kashmir, staying in Kashmir, getting jobs in Kashmir, not seeing the world outside. I, if I was somebody, I would make it a point that all these bright students for a short while should be taken, implanted in places like United States, United Kingdom, New Zealand, Australia, some places where they can see something which is being done much better way than what they have been taught, so that they can go back and carry with them the memories of these places and try to improve what is in Kashmir. Number one. Number two, I would like a private sector to come up in Kashmir, because when the patient goes to government hospital, it is the influential, it is the rich, it is person who has a connection gets the best. Poor man suffers. What is if there's a private hospital? all these people who can afford to pay go to the private hospitals, so that the facilities in the government hospitals are left for government and poor patients, and they will be looked after. And this private hospital should come up to the standard of what we have in United States. And insurance should come. Insurance should pay for the thing, because medical facilities are very costly now, and all cannot afford it. But if there's some way of insurance, it will help them. Plus, all these youngsters not only should shine in their medical profession, they should have a responsibility to their society also. They should fulfill their civic responsibilities. And the third is, whatever religion they are, they should follow their religion.
Dr. Saab, that is such an impressive pitch you made, and I hope everyone would see this last segment of our interview multiple times, because through that you're advancing science, you're advancing education, and you're advancing civil society responsibility, which each one of us have to keep very dear to ourselves. Allah Ta'ala ashe diyor, ashe su vatnavan bronch kun. Ashe kaam karin timan khatra, yiman khatra kah kaam hi chuna kara. So these are very powerful comments, Dr. Saab, aap keh rahe hain. Dr. Saab, I want to thank you so much. I know you mentioned briefly your family situation. I hope everything is going to resolve. Allah Ta'ala ki madad se.
Thank Pray for me, pray for me.
बिल्कुल इंशाल्लाह सब लोग प्रे करें डॉक्टर साहब के लिए. And we hope to see you back in Kashmir soon, Dr. Saab, to find the Langar Allaqaband Saab's another chapter in Kashmir to serve people of Kashmir.
Thank you very much, Altaf Lal. Thank you very much. I am highly honored to have been your guest, and I wish Kashmir Care Foundation best of luck. And people who are listening to it should, in one way or the other, contribute to Kashmir Care Foundation or a similar foundations, so that we are able to discharge our civil responsibilities.